So I think there's many different reasons why this pandemic has been so difficult for people, especially from an emotional point of view or mental health point of view. One of the main things has been that, many things have been out of our control or have been unpredictable right from the very beginning. We didn't know how long this was going to go on for. We didn't know how long that we had to maintain the public health measures. And now with the vaccine coming out, we see that that's a tool on our way to getting ourselves out of the pandemic. But there's been a lot of uncertainty around, is there enough vaccine to go around, and where do I fit into the prioritization of that? When am I going to be able to get my vaccine? And in some cases, there's been a lot of what seems to be mixed messages being sent out. So all of those are a challenge for us in our mental health. And the other thing I guess I should mention that's pretty significant, I think, for First Nations people is because of the public health measures, that loss of connection, that loss of social connection, cultural connection. We just haven't been able to gather together in the groups that we've wanted to over the past year. And there have been a lot of losses as well. I think it's really important for us to acknowledge the deaths and some of the severe outcomes that people have had during the pandemic, and the losses of elders, for example. Those aren't numbers that we're talking about. Those are people that we're talking about, and they're part of our culture, they're part of our communities. And so I think there's a lot of grief and loss in our communities at this time. So for all of those reasons, I think the pandemic has been really challenging. And it's important for us to talk about these things because we don't want people to suffer in silence. We want to create an atmosphere where people feel comfortable coming forward. And that includes, sometimes I think in mental health messaging, we say, reach out if you're having a difficult time. And that's true. If people do reach out, there are supports available. But I think it's also important to reach out to one another, to check up on one another and see how each other is doing, because that will, sometimes people won't come forward themselves, but once they're asked about it, they might feel more comfortable sharing how they're actually feeling. And then, people can, help can be offered, and we can connect people with services or give people some ideas of how to help themselves at this time. One of the important things is to recognize that the past year of living under the public health measures related to the pandemic has affected all of us, but in different ways, depending on people's circumstances and situations. And the same is true for different age groups or age ranges. For children, for example, the youngest children, I think a lot of parents, what we've heard is, because the children haven't necessarily been able to get together in the ways that they had before. School has been interrupted, for example, or play groups or organized sports or other activities. Is, the children aren't necessarily connecting as much socially as they would under typical circumstances. And then, parents have expressed concern about children falling behind academically. And so that's one thing too. And, for children, they themselves, we are, First Nations people in general are very, we're very connected to each other across generations. And so not being able to spend a significant amount of time with extended family members, including grandparents or aunties or uncles, has, I think, impacted on people's mental health. For the older adolescent age group, that I think has been really challenging for people, not just with the academic aspect to it, that people haven't, perhaps there's worry about people falling behind academically, but that is a really important milestone for adolescents to be able to socialize with their peers, and mature in those relationships. And so I really, I really raise my hands to adolescents who have been working hard and trying to continue to do their schoolwork and trying to follow the public health measures as best they can, because I can appreciate how very difficult it is for young people to do that. For adults, I think over the past year, there has been a whole, the number of stresses that people have had to contend with are almost too numerous to mention in some ways. For example, if people are employed, their work situations have been greatly altered. Some of us have had to switch to working from home, which has its own challenges. But there may be economic worries for many people, or people have feeling, that they have to be at their job and that they can't miss any time for hospital appointments or for bereavement leave because of economics. They have to continue to work. And then in addition to all the stresses that I mentioned earlier about just living with this uncertainty, living with the losses that we've experienced over the past year, it's really been a challenge for people. And, there haven't been that many actual studies done. But the ones that have done our surveys show that, the mental health impacts of the COVID-19 pandemic are significant. And they will, we will have to address those going forward, I think, for some time to come. For elders in the community, I think that, the COVID-19 pandemic over the past year the impacts have also been very significant in a number of different ways. Not just the uncertainty and the unpredictability of the pandemic, but knowing what we do know about the virus and the illness that it causes. The older age groups have been at severe risk of having more severe outcomes related to COVID-19 illness, and including death. And so, living under that stress, that uncertainty of, will I or won't I contract the virus, that for all of us is there, but especially for older people and our elders. Our elders are our cultural knowledge keepers. They are a very valuable resource in BC First Nations communities. And so I'm happy to see that, the vaccine rollout has included them as the first priority. But there certainly has been a number of challenges for them. Some elders actually may be isolated from their families, and it may be very difficult, for example, for them to do things to meet their basic needs, like get groceries or attend medical appointments and things like that. So I think this year has really been a challenge for them. And of course, on top of everything is that overlay of a lack of social connection. Not being able to see extended family members, not being able to hold and hug your grandchildren if you have them, or even just get together with, your friends and spend time together. I think there have been so many losses over the past year that, as I said before, it will take us, I think, some period of time to overcome the trauma of the pandemic. I don't think that we can talk about the mental health impacts of the pandemic without considering anti-Indigenous racism. And racism has shown itself at many different places during this pandemic. So, for example, people have been reluctant to go get tested, for example, at a mass testing center out of fear of how they've been treated. Or certain communities have experienced a lot of stigma when there have been clusters or outbreaks. And that can't help but cause additional stress and worry for people. And now with the vaccination rollout, we're hearing some stories of where racism becomes part of the issue, where it's why have you been vaccinated and I have not been? But one thing I want to share with BC First Nations people and communities who we work for is that we have to recognize that there are so many reasons why we are an at-risk population. And the vaccines, we were prioritized for the vaccines because of that risk. And once, there are other priority groups as well, but now we're seeing that the rollout is happening to different age groups across the province. So my hope is that, those instances of people saying racist things or behaving in a racist manner regarding the vaccines will reduce. But clearly, we know that we have a lot more work to do in terms of Indigenous specific racism in British Columbia. That we have been through so much, but we do now have hope over the horizon, that things will start to change, things will start to open up again. We will be able to gather together with our friends, with our family for community events. And we will be able to, basically, hopefully go back to participating in life the way that we did before, probably with a few changes. But I think I really do believe that the worst is kind of behind us. And I guess I just want to acknowledge everyone's efforts in trying to keep themselves, their families, and their communities safe over the past year. It really is important to acknowledge how hard people have worked, but also to acknowledge that hope that's in the future.